We've had briefing going for over 3 years now, and the process that when we introduced it was quite time consuming. We ended up shutting the theatres down for a half-day session completely so that we could run a workshop on the importance of the introductions of the briefing and the debriefing to the team. We have buy-in with most of the team. There's obviously still certain people who think that it's not needed, occasionally, usually surgeons. We very quickly got buy-in and support from the nursing staff, but it was a lot harder to win over the medical team, who often said that they knew the plan for what was going to be happening, so why did anyone else need to know it? The nursing staff very quickly came to see that it was going to be helping them in their role. We've been able to use the briefing to get new equipment or to avoid problems before they occur. So it might seem like the day's gone smoothly, but only because we've had the discussions as a team about what's going to be happening and what to expect. We did start the implementation off in one theatre, and I think that was a wise thing to do. We were focusing on having champions in one team at a time, and I would recommend that to anyone. And then we slowly spread it out to the rest of the theatres until everyone was doing it. And while we did that, we had champions who were able to lead and guide and support in each of the theatres. And we had a lot of team communications around how it's going, what we're doing with it, a lot of talk at all of our housekeeping meetings. And so staff weren't just handed something and thrown into the deep end, not knowing what to expect. We have had to continue to provide quite a lot of support even 3 years down the track, because if you stop talking about something or putting focus on it, then it becomes less important in the team. So while it might be embedded, that's because we are continuing to make it a priority. We've seen quite a decrease in the issues on the debriefing forms. We have forms that we fill out with any of the debriefing points from the day, and so it's been quite interesting to monitor the decrease in issues on those. Initially, a lot of the issues that were coming up were being repeated day after day, and so it gave us an opportunity to actually get to the root of the problem and deal with those issues. And because we had the formal documentation, we were able to use that to support arguments, for example, for a second image intensifier. We had the data there that showed that there were clashes with the use of that in the department. While we see that the day is going much smoother, it's because the issues aren't actually occurring. It's not that they're occurring and then we're dealing with it in briefing. It's that we're able to prevent them happening in the first place. We do have talk from the nursing staff that they feel that their opinion is much more valued, and that they're much more readily able to speak up, which obviously is a huge safety point. If they're able to speak up and they're expected to speak up in the briefing, then they're much quicker to speak up if there's a problem during the day that they're concerned about. And so we certainly do see that staff feel that they are able to contribute and that their opinion is valued, and that's been a huge bonus that's come out of it. I certainly do recommend that other hospitals take the briefing and debriefing on board, but not that they just start it as a tick box exercise, that they actually place the focus on that it warrants. It's not something that can be just introduced by handing over a form and saying, here, fill this in. It actually needs to be discussed at length, the benefits and the reasons for wanting to do the briefing and for why we do it. And certainly I would recommend that any hospitals introducing that have champions on board before they start the process. It's certainly been invaluable in our DHB, and I would recommend it to everybody else to use as a tool to value the staff and to prevent problems and improve teamwork and communication.